Hi there, I'm Dr. Emily Porter. I'm the Austin Love Doctor, and I'm also a mother of 4. And I was an ER doctor, board certified, working in the ER for 12 years. And I had my children and decided that my job was no longer fulfilling. I had always wanted to be a doctor, and I thought I helped a lot of people in the ER, and I loved what I set out to do, but things changed. It wasn't just about my kids. But I just lost my passion for medicine, as I'm sure many of you can also relate. Also, my life changed at home. Having children completely took a devastating effect on my libido, on my ability to enjoy sex, and let alone just the time to even find time to be with my husband, because I was working night shifts and sleeping in the hospital and missing out on my kids. I just realized how unhappy I was. So I went to have some treatments done to see if I could help my libido and my sexual dysfunction. And I had some vaginal laser done, had an O shot done. I got on some hormones and completely changed my life. It strengthened my marriage. I got my spring back in my step, and but I realized I still didn't like my job. What I liked was how much better I felt. And so I decided to change my career. I left my ER job. I was able to open a med spa, and I started offering these treatments to other patients. And I did some other things, some aesthetic treatments, but what I really found was that the most benefit that I got in a day was helping men and women, especially couples, be together again. And I have people crying in my office, and I'm crying with them. And I have so many women in their 30s and 40s and 50s who want to be with their husband and they can't. They're frustrated. They've been to the doctor, and the doctor just told them they need an antidepressant, because it's what you do when you have a 15-minute appointment. You get paid $20 to be in that appointment. I have men with erectile dysfunction and Peyronie's disease. I have men who haven't been able to have an erection after prostate cancer, and I've helped all of them. I have a lot of people that are very, very happy. And you know what? I'm way, way happier. So these people are coming to you before they're coming to me. They're coming to their family doctor, their gynecologist, their urologist, and you might not know how to help them, because there's a lot of new technology out there. You've heard the buzz about stem cells, shockwave therapy, maybe you've heard about some of the new drugs out there for women. None of those drugs really change tissue for women, though. They're confusing. They work on your brain, but they don't actually change the underlying problem. So I kind of took the last 4 years and all the information that I've learned going to all these different conferences, talking to patients, and I've sorted it out for you. I've sorted out how to put together a protocol to help somebody who wants to have better sex, a man or a woman, or has problems with the sex that they are having. It involves going through their medication, talking to them for an hour. I get to spend an hour with my patients, looking at their medication history, looking at their problems, looking at their medical history, and then offering them different treatments that actually change their tissue, that can affect their brain, and can really affect their life for the better. So I'm super happy now, and I've lived this. I've done it. I quit the ER. I teach a workshop every single month because there are so many patients out there, and I can't possibly help all of them. There's only 8 hours in a day, and I'm super busy already. So what I'm doing is I'm actually teaching other physicians how to do what I do, how to treat erectile dysfunction, dyspareunia, lack of libido, anorgasmia, Peyronie's disease, how to do it with medicines, how to do it with new innovative treatments like shockwave, platelet-rich plasma, the O shot, the P shot, a special protocol for Peyronie's that I've developed. And I'm actually so good at it that I became the #2 prescriber of Vyleesi in the entire country, which is a medication for women to help with their desire. And I'm just one doctor in Austin, Texas. So I love what I do. I want to help other physicians love what they do. Maybe you're somebody who actually could benefit from some of these treatments yourself, just like I was. I made myself the guinea pig. I had no idea that it was going to lead to this 4 years ago. So I'm in Austin. I hold a workshop every month, and I would love to have you down here. It's a great city to visit. I feel that you'll get your money's worth and that you'll enjoy it and learn quite a bit. And if you don't enjoy the class and you don't feel empowered to go out and help men and women and inspired to help people, then I will gladly give your money back. I don't keep anybody's money if they're not happy. And so far in 2 years of that, I haven't had to do it one time. So please reach out and come down and see me, and I look forward to meeting you.